I felt that amongst the many technologies out there, focused ultrasound was quite unique. It's non-invasive, it's sound-based, and it has a lot of ingredient as a therapeutic modality that I felt was very relevant to the idea of improving and probably reimagining how veterinary medicine happens.
Welcome to Curing with Sound. I'm your host, Dave Hendrick. Dr. Ashish Ranjan is a professor of radiation oncology and director of the recently formed Veterinary Research and Oncology Clinic at the University of Texas Southwestern. There, he plays a leading role in exploring focused ultrasound in veterinary and translational medicine. In today's episode, Dr. Ranjan discusses how emerging technologies like histotripsy and sonodynamic therapy are being used to treat cancer in dogs and cats, while also helping accelerate discoveries for human patients through their one medicine approach. Dr. Ranjan, welcome to Curing with Sound.
Thank you so much, Dave. It's great to be doing this podcast, and I appreciate Focused Ultrasound Foundation for doing this interview.
Well, thanks so much for being here. Can you tell us about your background and your path into veterinary medicine and research?
Yes, I initially trained as a veterinarian, and while I was enamored by all kinds of cases we would see in veterinary patients, what quickly dawned on me is the gap that was there between what was happening at the lab level and how some of those ideas were getting translated to patient. And that got me into more interested into understanding how we can augment the idea of bench to clinic research from a translational medicine perspective. And that took me to the path where I am right now, where we are figuring out new ways to bring those ideas into actual clinical practice. And in particular, I felt that amongst the many technologies out there, focused ultrasound was quite unique. It's non-invasive, it's sound-based, and it has a lot of ingredient as a therapeutic modality that I felt was very relevant to the idea of improving and probably reimagining how veterinary medicine happens. And that's how I got into this field of work.
Excellent. I previously heard you talk about developing your own nanoparticles, for instance. What does that involve? And can you just draw that connection between nanoparticles and the focused ultrasound research that you do?
Absolutely. So nanoparticles are typically made up of synthetic materials. They could be polymer-based, they could be lipid-based, and many other types that are out there. Typically, they are in the range of 100 to 300 nanometers, and they are designed in a way that they can be loaded with anti-cancer drugs and drugs that treat other diseases as well. They can be loaded with various kinds of genetic materials that can manipulate things locally. And they're designed with a particular intent. The way conventional therapies are done, whether it's gene therapy or drug delivery, if you just inject the drug by itself in a patient, it goes everywhere in the body. It doesn't have any kind of a GPS mechanism that tells it to go to a tumor versus not go to a healthy tissue. So the whole intent is to leverage these synthetic materials and load them with different kinds of drug agents so that they can be delivered in a more targeted fashion to a solid tumor or other disease sites. But nanoparticles by themselves also have some challenges. If they end up being in a tumor, sometimes they don't release their content intratumorally. Sometimes, even when the drug is released, it's released in a certain part, at least in the context of a tumor, and it doesn't distribute uniformly across tumor microenvironment. And that's where focused ultrasound is a critical player because by using a drug plus device fashion, we can modulate the tumors in a manner that allows more drug to be released or to be distributed within tumor environment. And beyond that, focused ultrasound inherently also has a lot of biological modulatory capacity. So if you have nanoparticles that do something similar, you can synergize those effects. And that's how you can bring the idea of nanoparticles or nanomedicines within the framework of focused ultrasound therapy, which I find pretty cool. And that's where a large part of our effort is currently focused, not just at the preclinical level, but even towards the veterinary side.
Excellent. You explained that very clearly. Thank you so much. You're leading research involving radiation and histotripsy in dogs and cats with solid tumors. Can you update us on what you're seeing there?
Absolutely. So, for your audience, histotripsy is focused ultrasound based technology. And essentially, what it does, it lyses cells and releases their content wherever you're delivering the sound energy. So, in some ways, it's a tissue lysis technology. And the great news is histotripsy is now getting realized into clinical practice for liver cancer treatment in particular. So it is sort of coming to age in terms of what it can do in patients. Likewise, radiation therapy has been there for many decades, and it also has cytotoxic effect. And by delivering radiations locally, you can generate cell kills, and by doing so, you can induce and we can induce uh, tumor. We can induce regression of tumor growth. Now, the biggest challenge with both histotripsy and radiation therapy is while they're effective locally, their ability to treat untreated tumors is kind of limited. So, while you can locally target both histotripsy and radiation therapy, whether they can take care of tumors that are not being treated is somewhat challenging to achieve in a clinical setting. So the whole idea of our trial, which we call it as a fusion trial, focused ultrasound combined ionizing radiation therapy or fusion, is that we can leverage the individual abilities of what histotripsy and radiation therapy do, but more importantly, we can leverage some unknown benefits of these two modalities. For instance, histotripsy has been particularly shown to be very immunogenic. It can activate patients' anti-tumor immune system. And when it does so, cancer cell immune cells can come to the tumor site, get trained, and then they can go and take care of untreated tumors. Likewise, radiation therapy has also been shown to do something similar in some settings, some clinical settings as well. But as standalone therapies, their effects have not been super optimal. So our whole goal is by using this fusion paradigm, we're hoping that they synergize together.
Very good. Excellent. It's my understanding that you treated a mast cell tumor patient using focused ultrasound and 5-ALA in a study funded in part by the Focused Ultrasound Foundation. Can you tell us about that study and the patient involved?
Yes. First of all, I'm very thankful to the foundation for continuously supporting our program. And this trial that is foundation funded is essentially trying to understand how sonodynamic therapy, which is another way you can leverage focused ultrasound's capacity to improve outcomes in patient, can help induce a tumor remission. So sonodynamic therapy is also a non-invasive approach. It is non-thermal by itself, and it is also it uses low intensity sound waves. So while histotripsy and other technologies are very uses stronger energy delivery in tumors, sonodynamic therapy, in contrast, delivers sound waves at lower intensity. So in this foundation funded trial, what we're trying to do is we are enrolling patients with mast cell tumor, which is a tumor that happens in the skin of dogs. It is not only locally aggressive, but it can also spread to other parts of the body. So it has potentials to be locally aggressive as well as being systemically malignant in several settings depending on the grade. And the biggest challenge with treating mast cell is you don't know what margins to take. It's kind of a difficult disease to to tackle in vet patients. So our whole idea is we will inject 5-ALA, which is one of the sonodynamic sonosensitizer agent, to patients, and it has already been shown to be safe in canines. So there is already a little bit of safety information out there. And then the trial is aiming to combine them with three different parameters of focused ultrasound to see which one works better. So with that in mind, we had our first patient enrolled, great news, recently. And we combined 5-ALA with a certain type of sonodynamic therapy parameter. And the treatment was again safe to administer in the patient. And we are at 2 months, and the last I remember is we had stable disease in the patient, so there was no flare up, which I like. And we're still monitoring that patient. So stay tuned, and hopefully we'll have more information as we grow this trial further.
That's great. Can't wait to hear what happens with that, and we'll hope for the best with that patient.
Yep, absolutely.
You've been doing this work for many years. I know you've seen tremendous evolution in the field. Is there something happening today that you never would have imagined when you started doing this work?
Yeah, sure. I mean, initially when focused ultrasound came into being, we thought of it more as a ablative therapy. So the whole intent was you go deliver a significant amount of sound energy to a region of interest, and you kind of zap out all the cancer cells or something else that we're trying to target. But what has been tremendously achieved in the last decade, and I think it's only going to grow further, is some of the non-ablative but equally important properties of focused ultrasound. For instance, leveraging it to open blood-brain barrier and to get more drug delivered to the tumor. That's a great achievement because that has been a recurring and a persistent problem in the field. So now we have an approach that can allow us to do so, using it to generate non-ablative heating in tumors. So for instance, combining with temperature-sensitive liposomes, that is again a big achievement. But I think where the biggest, at least from what I do in my own research, has been as an achievement, is its ability to reprogram the tumor immune environment. I mean, imagine a technology that is by delivering sound waves or sound energy to a cell, manipulating it in a fashion that allows the immune systems to not detect the cancer cell. I think that's a pretty big leap for the therapeutic technology as such. And amongst all the technologies, I feel its ability of being non-invasive and still being able to do both ablative and non-ablative manipulations of a tissue of interest, I think has been a tremendous advancement in my mind.
So many different potential applications for focused ultrasound than what we initially thought. You touched on this earlier. Can you explain the concept of one medicine and why it's such an important idea in your field?
Yes, one medicine has been, as a concept, being for many decades, and the whole thinking process of one medicine is both humans and veterinary patients, especially dogs and cats, spontaneously gets many kind of diseases. For instance, diabetes, cancer, neuromuscular disorders. So there is a lot of parallel between what a human gets in terms of various kinds of spontaneous diseases as well as what a vet patient gets uh, in the sense of the same kind of disease processes. The one medicine therefore envisions that because many of these disease processes are happening spontaneously in vet patients and in humans, why are we looking at them in silo? They should all be treated under the same umbrella. And the biggest benefit of thinking of them as one umbrella idea is the differences in the lifespan between the vet patient and the humans. So, if you think of humans, we typically live for 70 to 90 years. Dogs and cats typically live anywhere between 10 to 20 years. So, you have a compressed lifespan and you have the same kind of spontaneous disease happening in a patient population that is very similar to humans. So, by studying and doing trials in vet patients, you can understand the feasibility of treatment outcome faster. And that way, you can inform human therapies also in a much more meaningful way.
Can you tell us about the Veterinary Research and Oncology Center at UT Southwestern? It sounds quite leading edge, and I'm just wondering what makes it different and special.
So, veterinary research and oncology clinic is a unique concept from many perspectives, I feel. As we just discussed, in a majority of cases, while we have made significant advances in both human and veterinary medicine, in some ways, I feel that veterinary medicine lacks the discoveries that are made on the human side because it's just how the field has evolved over many years. Veterinary Research Oncology Clinic is situated within the medical school campus. So, what's happening within the one medicine umbrella is happening both on the human side and on the vet side. So, there is no lagging of technologies, which I feel is quite unique. VROC is strictly a clinical trials facility. So all of our patients come under clinical trials. So it's mandated by our institutional ICOOC program. But that said, since every patient is enrolling within a clinical trial framework, it allows us to execute the trials in more organized fashion, I'll say, in a more targeted way. And if we can analyze the samples and use the biologies of it to guide the treatment, both in humans and veterinary medicine, that would be the ultimate reward. And that's one of the missions of our clinic, which is to perform clinical trials in veterinary patients and sometimes in parallel, both in veterinary and human patients, and use the biological information to guide therapies in both populations. So while we in some ways function like a hospital, we are a very clinical trial driven facility, which makes it an interesting approach to pursue.
It sounds like a unique environment.
Yeah, it is indeed a very unique environment. We're still in the formative years. So there's a lot to be done in terms of establishing it as you think and realize that we are not a veterinary school, we are a veterinary program situated within a medical school. And sometimes the patients need a lot of other specialties as part of their care. So we have been focusing quite a bit on partnering with other practices in the town to share knowledges. Hopefully, some of what we are doing, they'll be able to use it. We are a not-for-profit setup, so our intent is to bring the best kind of trials that are available in our repertoire to the um, clients and also to all the referring practices, at least in the Dallas area and around the country.
It sounds like we'll see a lot of great information coming out of UT Southwestern in the next few years. We know the clinical trials are so critical for demonstrating safety and efficacy, but what are the biggest barriers for preventing these treatments from becoming more widely available for pet owners?
There are significant barriers, I would say. At least in the context of veterinary medicine, I feel that the barriers can start all the way from infrastructure. For instance, if you think of focused ultrasound, it needs an equipment, a dedicated staff who can run the device in a manner that helps the patient's treatment on a day-to-day basis. There's a lot of knowledge that is required even to deliver these treatments. If you want to deliver radiation treatments to a patient or combine focused ultrasound with radiation, for instance, you need dedicated facilities that many of the vet clinic around the country are not equipped with. Well, some specialty places can do so, but not every place in the country. So access to care, I think, is a big hurdle. I also feel that cost of treatment could be significant when it comes to doing some of these procedures in patients. And also the education and outreach side of things. A lot is not known in terms of all the benefits that these therapies bring to the patients. So that's another area that I feel need a little bit of more work from us. And I think, they can be overcome, but these are some of the glaring challenges that I can see for bringing some of these technologies to patients.
Looking ahead 5 or 10 years, what are you most excited about in focused ultrasound and veterinary medicine?
This has been an exciting century in many ways. When we were treating cancer in the 20th century, we were thinking of treatments in baskets. So we had a pool of patients who needed chemo. We had a pool of patients who needed radiotherapy or surgery or a combination of all of them. But we never attempted to personalize therapy on a per patient basis. So in this particular century, I feel that we are making fast advancements towards personalizing therapy, and focused ultrasound is also positioned to play a role in that integrated platform where hopefully by doing more detailed biological investigations of each patient's tumor or other tissue types that are being targeted, we can make them more personalized on a per patient basis. And I think that really would be the leap for the field, and that would make treatments not only more effective, they will maybe make it more less toxic, would improve patient compliance because the treatments won't be delivered in a basket like fashion, but more on a per patient basis.
Is there a patient or a case that has especially stayed with you or reinforced why this research matters?
Yes, thankfully we have had the opportunity and experience of treating many patients with different kind of malignancies and diseases in at least in dogs and cats this far. But actually, I vividly remember our first case that we treated. It was a case of B cell plasmacytoma, which is a benign but recurrent mass. So it can, if after treating, sometimes it can come back. And we had a case where the tumor was growing in the lower left lip region, and it was a recurrent mass. And the surgeon came to me saying that, hey, this is if I were to surgically remove this, it's on the mandible, and I'll have to remove the whole bone, and it may have an impact on the quality of life of the pet. So do you think we can do something? And I said, let's enroll this pet for a focused ultrasound based non-invasive thermal ablation based approach. And gladly we did so, and we had a very nice response in that patient. The tumor went away. There was very nice healing of the treated region. And the PET remained tumor-free, I remember, for more than a year, which was very exciting for our clinical team, especially for a mass that was recurrent. And this just tells you that how much investigational approaches like that can help pets as well as their families with getting a better quality of life. So the surgeon again spoke to me saying that if you were to do something to reduce the size of this tumor, maybe we can go back and do some minor corrections to give this dog a better shot at life. And we again enrolled that patient, and we had very good response. The tumor almost went away, and again that patient did very good on that therapy. So cases like that have stuck with me.
Fantastic. Well, thanks so much for joining us today on Curing with Sound, and hope you have a fantastic afternoon.
Thank you so much for inviting me to do this podcast, and I look forward to continue working with the foundation to improve the field of veterinary medicine, leveraging some of these exciting technologies that are coming through focused ultrasound.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter, News Digest, and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information on Focused Ultrasound. We would also be grateful if you would rate and review the show.